Healthy Conversations is made possible through a grant from the William L. and Ruth T. Pendleton Memorial Fund.
Hi, my name is Amber Mabry. I'm a CT technologist here at Dignity Health, Yavapai Regional Medical Center. Today I'm here to talk to you about our low-dose lung screening CT program. So let's start by talking about lung cancer. In the world today, about 45% of our cancer deaths are due to lung cancer. And this is important with this exam because it is a low-dose lung screening exam, meaning hopefully if you get this exam done, we'll be able to catch this cancer early enough so that you can have less invasive treatments and be more successful. So who qualifies for that low-dose lung screening program? Well, if you're between the ages of 55 and 77, and depending on your ordering physician and your insurance, sometimes between the ages of 50 and 80. If you're non-symptomatic, so meaning you don't have a cough or any current symptoms, if you have no prior lung cancer, and if you're a current smoker or you've quit in the last 15 years and have a history of heavy smoking with cigarettes. So what is a low-dose lung screening CT? Well, just like the name implies, it is low dose. So to give you an example, your average background radiation per year is anywhere from 3 to 5 millisieverts. That means just from the sun and your environment around you. A low-dose lung screening CT gives you about 1.4 millisieverts. That's half the dose that you would receive in an entire year just from your daily activity. This is important because it maybe might encourage somebody to do the screening versus waiting till the cancer aggresses in the lungs. When we're doing this exam, we're looking at particular anatomy, and that mainly is your chest. So we're looking at your lungs, and we're looking for particular things within those lungs. What is the CT? I get asked this question a lot. So people will be like, Amber, can you please explain to me what a CT is, how it works, things like that. So basically, to start with what CT stands for. It stands for Computed Tomography Axial Imaging. And basically, the way I describe this to patients is, imagine your body is a loaf of bread. In particular, right now, your chest. And we want to see certain particular areas within that chest cavity. So if you imagine you take a loaf of bread and you cut it into different slices, our doctors are able to use our imaging to pull one slice out and get really detailed imaging, and then put it back and grab another slice and get detailed imaging through that. So as a patient, what can you do to prepare for this exam? Well, there's a few steps. First things first, because it is radiation, we have to have a physician's order. So make sure you get that from your physician or that it's sent to our facility prior to your exam. Next, there's no need to prep for this. It's real simple and easy. So you don't need to fast, there is no oral contrast, and there's no IV contrast. Next, wear comfy clothing. We're gonna change you for every single examination every time you do this. I know, we all love the gowns, but as long as you come in comfy clothing, it'll be easier to change out of. And we love our jewelry, leave that at home. It takes a lot more time to get it all off. The last thing is come with your questions. As technologists, we love to make sure that when you leave, you feel like we've answered all of those for you. So bring those with you. And if we're not able to do that, myself or my colleagues, there is Jennifer Harvey. She's our low-dose lung screening coordinator. She knows every answer to any of these, and we'd be happy to direct you to her. So when you get to our facility, the things you can expect is when you arrive, you will need to register for your exam. This takes anywhere from about 15 to 20 minutes. Make sure you bring your photo ID, your insurance card, and again, your physician order. After you've registered, your technologist will greet you. We'll take you back to the changing room. We'll change you into that gown and the appropriate attire. And then we'll take you into the room and we will explain the entire exam to you. We'll answer all your questions. We'll get thorough patient history for you, and we'll make sure that you feel comfortable before we get started. When we do get started, you'll be laying on your back. And yes, our table is not super comfy. It is not a Tempur-Pedic, but we'll make sure to do our best to make you as comfortable as we can. So if you need a warm blanket or you need some more pillows under your head, let us know so we can do that for you. Our job is to make you as comfortable as we possibly can so that when we actually go to scan you, there's no motion in your images and we don't have to repeat anything, especially with this low-dose lung screening. It's super important that we do not repeat your images to keep that radiation as low as possible. So let us know at the very beginning what we can do for you. The entire exam takes anywhere from about 30 minutes, and that's not the entire scan. That's us getting patient history. That's us making sure you're comfortable. That's getting you positioned. The actual scan time for this is about 8 seconds. Everybody I scan goes, that's it, we're done, we're completed. It's very quick. You're gonna hear some noises over the CT machine. This is completely normal. Also, you'll hear some breathing instructions come over the machine. Just take a listen to those, when to breathe and when to hold your breath. That segues into the next thing everybody comes in and they're afraid of. Most people are claustrophobic. There's many things we can do as technologists to help you with this. First things first, you can get medications from your ordering provider to kind of help ease you or calm you down. If you're not wanting to do that, we can put a washcloth over your eyes. We can talk you through the exam. This has helped a lot of people who are claustrophobic. The other thing people are concerned about is difficulty holding their breath. Some people have COPD, there's shortness of breath, they have asthma. There's many factors as to why they have a hard time holding their breath. So just to remind you, it's only 8 seconds long, and we'll do our best to let you know what's happening so you're able to do that. And the third thing that most people are worried about is the radiation. As I said before, it is half the dose that you would receive in your daily life per year. So a lot of the questions we get is, when can you expect your results? Here at Dignity Health Yavapai Regional Medical Center, we have a fast turnaround time. It's usually 24 to 48 hours to get your results. It's your ordering provider who will be receiving those. And you as the patient have access to your report as well within 72 hours. And that'll be available on your YMC Care Connect portal. As I mentioned before, Jennifer Harvey is our low-dose lung screening coordinator. This is her information that you can get a hold of her. She is passionate about this program, so reach out to her with any questions that you might have. Thank you again for letting me share this with you, and I hope you guys have a great day.